Access to quality healthcare is a fundamental right, yet for many in Ghana's rural areas, it remains a challenge. But here in the Tichman North constituency of the Borno East region, a private health facility is changing that narrative one patient at a time. The Zunuo Hospital is marking 7 years of service with the commissioning of a new state-of-the-art administration block, a symbol of its growing commitment to the community.
This is a remarkable day in the history of Zunuo Hospital. We started on a very low key, on a very low note. As we grow, we responded to the health needs of the people. We keep on adding on more facilities. As the pressure keeps on, we have to also keep on improving our services, our infrastructure, our diagnosis, and everything that we need to provide to be able to meet the healthcare needs of the indigents, the communities around.
But beyond the bricks and mortar, the hospital's medical team is confronting a silent epidemic. Chief Executive Officer Dr. Emmanuel Sinvla identifies non-communicable diseases as the leading battleground.
Currently, one of the most critical health conditions are the non-communicable diseases: diabetes, hypertension, asthma, and it's becoming so rampant. And I think adding this facility, we have made provision for a lot of diagnostics, a lot of space, and a lot of resources, both human and equipment, to be able to cater for these emerging health conditions, mostly the non-communicable diseases.
The delay in seeking proper medical care is a concern that echoes in the hospital's mental health unit. Gilbert Dawn is a mental health practitioner here. He shares the alarming increase in mental health illnesses in the area.
In recent times, the rise in suicide issues is coming up, and then people harbor things and keep on smiling outside. Now, very often, when I encounter patients with mental issues, especially those in the bad state, you realize that they would have visited a lot of traditional healers. Others think that is spiritual. So, for that matter, they will have to seek for spiritual care and spiritual interventions before. At the long run, when all is said and done, and they don't see any results, then they come back to the hospital. At which time, the disease has already progressed. But one thing about mental health and all other diseases is that the earlier you seek for intervention, the better the prognosis.
The team at Zunio is fighting back not just with treatment but with education. They are embarking on community outreach programs to demystify illnesses and encourage early reporting.
We keep on sensitizing the public and the general populace that anytime we encounter some of these cases, let's have a first resort in the hospital. If it fails, I mean, nobody can dispute the existence of spirituality, but then we say that it's a disease that has come. Let's seek for medical attention first before we go to the traditional and spiritual healers.
The story of Zunuo Hospital is one of modern medicine meeting deep-seated cultural beliefs. It is a story of a facility providing a fundamental right while pleading with the community it serves to trust science and come early. Reporting for Joy News, Anas Sabit, Tichman.